we are back again with a clinical conversation with Steve Kiak, who is the Digital Health Manager at CORA Physical Therapy. And of course, we have Ashley Langford, our Director of Clinical Excellence at CORA, and also the Director at the CORA Institute for Clinical Excellence. And we today are talking about, we're going to start by talking about the difference between telehealth and RTM, which is remote therapeutic monitoring. Either of you can correct me if any of that was wrong. But I would first like to ask Stephen, what is the difference between those two?
Absolutely, and that's a great question. Telehealth is very comprehensive and it involves more of, doing a full evaluation, a full assessment on the patients, and really building a plan of care and adjusting multiple aspects of their plan of care. Whereas an RTM is more of a pinpoint and answering that select question or that focus point that the patient might have between visits, or even involving a short video chat to maybe look at the patient's form on a specific exercise. Whereas telehealth is being able to do a full visit and able to modify multiple exercises, make sure the patient is getting through all of their sets and reps. And again, whereas RTM is more of just looking at that pinpoint and making a recommendation.
Okay, my immediate question, Ashley, again, jump in anytime. My first question is who goes to RTM, who goes to telehealth? Can I go to both?
Absolutely. You can go to RTM and telehealth. You can be on both services. Now, there are only select payers that cover RTM currently, and there's more payers that cover telehealth. So that's one descriptor that kind of balances out which one you're on.
So by payer, you mean so if I have my insurance will kind of dictate whether or not I can do one or the other or both.
Correct. So with RTM, it is currently at CORA, it is Medicare and Blue Cross Blue Shield and work comp in Wisconsin. There are more payers that are coming on board and they're following after Medicare's guidelines. So as time progresses, that is also being included in multiple payers such as Aetna, Humana, and others.
Yeah, get ready. We'll continue to see insurance companies embrace this. I think, just kind of stepping back, talking about these offerings as a physical therapist, the first thing that you want to know when you evaluate a new patient is what are their goals? What are they coming to us for? And the magic is that connection between what they've achieved in therapy and then what they can do on their own. And what Steve manages and offers with the team, to me is phenomenal because it helps to bridge that gap. They get to essentially digitally be in the person's home or wherever they are during the session, and there might be specific needs that they can see, and they take them with them over camera. It's a pretty cool option.
Can you describe? Okay, so who is it? Describe the person. Describe or even describe one of your experiences, Steve. Like what do we? Who comes in? How does this happen? Give me like the lifeline or the pathway that a person takes to get through all of this.
So yeah, again, you can have your evaluation either telehealth or in clinic for RTM. It doesn't matter; they're very comparable to one another. But I will give you a perfect experience of the value of RTM. I had a 78-year-old woman that is local to South Carolina, and she ended up having a total knee. She was evaluated in the clinic and ended up not being able to make a few of her visits, but she had a lot of questions between those, and I was able to immediately answer those. She even called me her pocket physical therapist, so I've kind of coined that term. And from those, she's having some weird symptoms such as shortness of breath, elevated heart rate. And I was like, oh, that's kind of interesting. Let me go back and look into your chart and see what might be going on. Maybe you have some previous history that could, allude to that. Maybe it's something, maybe it's not. So after I quickly reviewed her chart, I ended up reaching out to her and she described more of her symptoms, and some of them were kind of raising some red flags to me. I ended up trying to refer her to the ER, which is local. And she went down there and they did some more tests. And the doctor actually ended up calling me that moment and said, hey, I wanted to thank you so much for referring this patient to our hospital. She ended up having a DVT. That ended up saving her life.
Wow.
Chills.
Yeah, that's cool. Okay.
You know what? Just on that topic too, that's another thing that has always bothered me is, you've got patients coming in and something comes up. And no one's guilty of it, right? It's human nature, but either, you're ill or you've got something, you can't get in the clinic. One of the things that I think about is, let's say you've treated a patient, got them started, they're coming in to see you, and all of a sudden they're waiting on an MRI, and they've decided that they need to wait for that before they come back to therapy. And it's always been like a touch point for me. What's happening during those 2, 3 weeks or maybe longer that they're waiting on this golden picture that in reality they could have been progressing through exercises. So again, whether it's telehealth or the RTM, it's just a great option that we'll see more and more of to be able to fill those gaps.
Well, and I think right, it goes without saying, but it's an important message to share. Say for anybody that's not of the clinical audience listening, PT is important and effective only if people are following through with it, right? I can't just go in and go through maybe a manual therapy session and think that's going to work. You have to do it while you're there, but you also have to take that responsibility home with you, right? To do the exercises and all of the prescriptive things that you guys say to do.
Absolutely. And to go off that is think about, how often you're in the clinic, 3 times a week, maybe an hour, maybe a half hour, maybe less. Where is the majority of your time spent? Where can digital health play a role in that time frame? We're able to see you in your natural environment. We're able to see you where you're doing your hobbies, such as maybe at the gym, maybe at the golf course, and make specifically tailored exercises to your goal set.
Okay, you said you can see me. Describe that. So what happens? Like we're talking like this. You have an app. You have do you send me my TheraBand? How does that work? What is the session like?
So Adam, you're
Absolutely.
saying if Steve was your pocket therapist. Got it.
Yeah, my PTP. No, PPT. Yeah.
Absolutely. So each telehealth person has different platforms. At CORA, we use MedBridge. Our process looks like our telehealth therapists send out a email prior to your evaluation or prior to your follow-up visit, and that email gives you a list of instructions. In that email is a link to get on the call. Once you click that link, it's going to ask you what state you're in. It's going to have you sign a confidential form, and our platform is HIPAA protected, so there's no patient information that could be harmed. Once that you're in the call, you'll be in a virtual waiting room, just as if you went to the clinic. From there, our telehealth therapist will go into the waiting room and admit you into the call, and it'll start your session just like this. And we can see face to face, we can build that relationship, and you can start by asking questions. This is where we're going to be kind of seeing at why you're coming to physical therapy, how we can help you, where we can relate into getting you back to what you truly love, because that's our vision. We want to get you back to what you want to do because that's what matters most.
Sounds like concierge,
Yeah.
go into a nice hotel. The way, the convenience and the way it's set up, it's great.
That is great. Okay, and again, what do I need? What if I don't have anything? What if I don't have weights, or maybe I don't even need weights, I guess. What if I don't have what you need me to have? What if you're like, hey, I want you to go lift that 5 pound dumbbell, and I'm like, I don't have that.
Absolutely. So there's items in the house that, mimic what we have in the clinic. Do you have a gallon of milk in your fridge? That's about 5 pounds. Do you have a cushion that we could use to kind of create some balance deformities? Good. You can close your eyes. Do you have a belt that we can use as a stretch strap? There are a lot of household items that mimic what we have in the clinic, and that's what we teach our patients because it is so important, like Ashley previously said, to do those home exercises, to have that commitment outside the clinic, because that's where we see the real boost in outcomes.
And those outcomes are kind of the same, right? We started the conversation by talking about the difference between RTM and telehealth, but they are one and the same. It's just a different. Help me again, describe the difference in a sense that RTM is only a check-in, right? And then a telehealth is the actual appointment. Like we're going through a whole visit almost, whereas the other one is like, hey, my neck hurts a little bit from doing this exercise. Can you just tell me if I'm doing it right or wrong?
Correct. And again, that's where, having that digital check-in has actually shown more engagement from the patients, which is actually leading to better outcomes than without it altogether.
Any other good data points you can share? Ashley, do you have any research? Let's hear about a
Well,
little bit
I
about
knew
that.
I was going to say this on the call, so I have to now. It's perfect timing. So one of the things that I've truly enjoyed, Steve is an amazing guy, just like his team and clinicians in general, right? So I enjoyed, like, when I had a patient that I was evaluating and they were the perfect candidate for remote therapeutic monitoring, right? It needs a new name, but what I enjoyed doing was kind of talking about Steve as we were getting to the end of the evaluation. I got my buddy who's going to take care of you, right? Obviously, my exercises I've given you are perfect, but if you have any issues, or you want to ask questions, we have someone that will reach out to you, connect with you, and help you through any questions that you have when you're not here in the clinic. And typically, Steve will tell you, like, I'll have the patient, I might text him and say, hey, can you speak to such and such real quick? And they make that connection. It's just a nice tag team type deal.
Oh, okay, wait. I think you just helped me understand something. So I'm the patient. I'm seeing Ashley, I'm coming in for care with you. I can't make it in, but or I have a question of some kind. You're like, hey, I'm gonna punch you over to customer service. I'm gonna connect with Steve. Steve's gonna say, oh yeah, no, this is what's happening. This is how you can. Is that how it works? I don't see Steve every
No,
session.
no. So think of us as a care team. Ashley and I have a partnership, and our partnership is for the patient altogether. Ashley isn't clinician A in the clinic, and I'm not clinician B outside the clinic. We're that patient's care team, and we are together working to get them that best outcome. So I might reach out to Ashley, be like, hey, so and so reported that they don't really like this exercise because they're getting this sensation of tingling down their arm when they do it. What they're telling me is that they're doing it this way. I corrected it slightly and modified the exercise into this one. Can you just review the one that you've originally gave or review the new one to make sure that it's appropriate?
Yeah, Adam, if I gave you these 3 exercises and through my arrogance, maybe you tried them at home and one of them you thought, this is stupid. I can't do this. I don't know. You might not want to come back and tell me that, but as Steve reaches out, you're going to be, hey, this guy in the clinic, he's pretty good, but this one exercise helped me through it. And then Steve's going to go, what did Ashley give you? Let me adjust it some. And that way you've got more than one set of eyes looking at you and helping you too.
And the insurance companies like this better, right? Because then I'm gonna get better quicker or more quickly, and they're at the end of the day probably gonna pay less. I'm gonna feel better quicker. Everybody's gonna. It's a win-win for everybody.
Because, like you said earlier, Adam, you have to do it to get the results, right? There
Yeah.
has to be that follow through and connection. Absolutely.
And it holds patients accountable. If we know and we can see that they're doing them, then we can kind of boost that motivation. Like, hey, I noticed that you did your exercises 4 times this week. That's awesome. That's going to do this for you in the long run. Versus those patients who aren't doing their home exercises, those ones that come into the clinic and you're like, hey, can you show me your home exercise? And they're like, what's a bridge? And then they're like, hey, I know I reviewed this with you last time. I want you to, use this remote monitoring, and I want to make sure that you're doing them correctly, which has videos of showing you the exercises, or reach out to our digital specialists. They can kind of review them with you. That's that gap that's being filled.
And it doesn't, and for the patient, a computer works, phone, iPad, like any of these things work. So there's no extra equipment needed there. That's all right. I learned a lot. Does anybody is there any final words here? Did we miss anything? Is there anything else you should share with either, again, the clinical audience or just the patient audience that's interested in understanding the difference between these two great forms of therapy?
Yeah, I as a clinician, um, I just want to say also that it was kind of fun because I could, some of my older patients, I made sure that they knew to give Steve a hard time. So there was already that kind of like jokingness. It just adds a nice flavor to the therapy and the team. It's immediately like, okay, these guys are definitely connected. They know each other, and it just made it enjoyable.
One of the biggest things that we also see as clinicians is patients that just don't finish their plan of cares. They never see it all the way out. And like, imagine that little extra tool in your toolbox that is like giving that patient to make them feel heard, making them feel, respected, make them feel like that their visions and their values are being fulfilled into their treatment. That's what RTM brings to the table in a nutshell is we're able to spend that extra little time, that extra little one-on-one conversation to make those patients feel that true value and to make them finish out that plan of care. There's those back end benefits that are just so valuable to not only us, but as clinicians, but to the patient.
So if I'm a patient, like if you are a patient, if I'm a patient and you hear we have this, don't think of it as an upsell. Just think of it as a great add-on. Like this is a great complement to your plan of care. Take advantage of it. And I want to say it was a couple of years ago, but I'm sure it's similar now. There was a high percentage of patients that dropped off after like the second or third visit. Like that's as many visits as people came in. Something hurts and they only spent 2 or 3 visits before they gave up on it, which is very sad to kind of consider. So, all right. Well, I think that's a good conversation conversation for now. I think we're going to jump into understanding, like, does it work? Like maybe some more of that in our next conversation. So again, any final words before we close this out?
No, this is great. Thank you.
Awesome. All right. Thanks, Al.